All right, so we're going to talk about lymphomas now, and there are two types of lymphoma we'll talk about. First is Hodgkin's disease. This begins in the lymphoid system and it metastasizes to other sites. So this is with leukemia, it begins in the blood. It begins with white blood cells. Lymphoma begins with lymphatic tissue. Okay, so what might we see? They may have fever, night sweats, unexplained weight loss, fatigue, anorexia, itching, and they may have swollen lymph nodes that are not that they don't have an explanation for. So if someone has swollen lymph nodes, they don't have an infection or pain in that area, that's something that we need to be aware of. It's diagnosed by lymph node biopsy, and then there's extensive labs and imaging to figure out where all the metastases are, okay? It's managed by radiation, chemo, or some combination. So when we look at nursing care, we're looking at the effects of the disease and the treatment, okay? Prognosis is excellent for Hodgkin's disease. Relapse is possible and secondary cancers are possible. Remember, secondary cancers are caused by radiation and chemo. Sterility is common due to the treatment and because radiation, and sperm banking is actually offered or should be offered for that patient. This is one of the most important things to remember. This is a disease that can affect young people. So young men who, young patients may actually want to preserve their reproductive cells. Non-Hodgkin's lymphoma is more common in children. It also originates in the lymphatic system. It tends to be more diffuse. It doesn't confine itself to the lymph nodes, and it disseminates through other body tissues earlier and faster than Hodgkin's. The mediastinum and the meninges are commonly affected. So this gets into the central nervous system and the mediastinum. Usually when this is diagnosed, it's widely disseminated. They are going to do lymph node biopsies, bone marrow, imaging studies, lumbar puncture to try to figure out where all it's located and what stage it is. This is treated with aggressive radiation and chemotherapy. The process is similar to the chemotherapy process for leukemia. So lots and lots of side effects to manage from those treatments. The prognosis in developed countries, the cure rate is 70 to 90% based on the stage when it's discovered. All right, the next section is going to be managing symptoms of cancer and side effects of treatment.